and position, sir?
I am Alassane Bakar Kamara, the Program Manager at Hfac Coalition.
Okay. So, why really the night monitoring?
Basically, the essence why we are conducting the night monitoring is for us to support the Ministry of Health and Sanitation and development partners to ensure that our facilities, most especially our hospitals, are safe by the provision of drugs at night, the availability of staff at all times, infrastructures, electricity, and to ensure compliance to the medical ethics code of conduct. That means staff must be diligent in providing the service. They must be on duty at all times, and they must provide the service required of them.
Okay. So, what do you want to achieve?
Basically, what we want to achieve is basically very simple. It's boiled down to the safety of the clinic. We want to ensure and complement the effort of the ministry in making sure that our hospitals are safe at all times, not only during the day, but they are also safe at night. And when we say safe, it basically means all the services starting from drugs are there available and the people get the drugs. Electricity is available, infrastructure, toilet facilities. So all these are the necessary things that should be in the facility to make the facility very, very safe, including staff.
Okay. And what are your monitoring strategies?
Our monitoring strategies basically focusing on 8 key areas. We are looking at the staff attendance. We are looking at the availability of drugs. We are looking at the electricity supply. We are looking at the toilet facilities. We are looking at staff attendance. So all of these issues are what our strategy is pushing, and we are also working very hard to ensure that there is high level of compliance and the provision of basic services in the referral hospitals.
Okay. So, what is your final message to the people of this country?
Our final message to the people of this country is for us, all of us, to come together as partners in development to support the Ministry of Health and Sanitation, the government of Sierra Leone, to make our facility, most especially the referral hospitals, very, very safe.
Okay. Thank you.
Thank you very much.
What is your name, sir, and what is your position?
I'm the National Coordinator of the Hfac Coalition.
Okay. So, what are your recommendations for improvement in the health sector?
As our report indicates, we have found out that a whole lot of the health workers, especially those who are on night duties, are not actually going to their duties at night. Sometimes when they go, they do sign and leave the hospital. One of our recommendations is that those in authority, the medical superintendents at each of the referral hospital, must ensure that they themselves also come to do some night monitoring at night, so that they ensure that their health workers are actually at work at that time. And those others who are also in charge, including the sisters and the sister and whoever is in leadership of the hospitals, ensure that they are also monitoring the health workers, especially those that are in night monitoring. And the other thing also we find out is that even the distribution of drugs, we also want to ensure that we also want the government also to ensure that especially the tracer drugs, the essential drugs, are also available at night, because we want to believe that especially at referral hospitals where we have maternal, where women are giving birth, we do ensure that the drugs are there, and also that the drug stores are open for them to be accessible to those that are there. For those where the drug stores may not be accessible, we are also recommending that the drugs be given to nurses in charge, so that in the morning we will be able to account for those drugs.
Okay. And what are your follow-up mechanism now that you've launched your first night monitoring report?
As the follow-up mechanism is not very much different from all the reports that we also produce. One of the way we actually do follow-up mechanisms is to make sure that all our reports relating to our findings in hospitals are published, are actually reported to all the stakeholders in the community, as well as the donors, as well as the Ministry of Health and Sanitation, those that are in leadership of the ministry. We also ensure that some of our reports also are published in newspapers as well as in radio, so that we can galvanize public support for some actions at that facility level. The other thing also we can do is that we also go to the stakeholders of those meetings and engage them in dialogue, so that we ensure that some of those recommendations that we have actually done are being looked into and something done about it. So we do meet with the stakeholders, as well as, like for example, we also go as well with regard to the referral hospital. We go to each of the referral hospitals and have meeting with the medical superintendents and the leadership of the hospitals and give out our report to them, and we discuss with them on the issues that we have found out, so that at the end of the day we can have something done about it.
Okay. So what is your final message?
My final message actually is that we want the medical practitioners to know that they are actually in charge of saving lives at the hospital, especially at night, because actually it is at night that most people, those that are sick, actually get a lot of pain at night in their sickness. So we want also to appeal to them that whenever it is time for them to be at the hospital, let them be at the hospital and let them give all the kind of care and needed at that time, so that we can save life at that point.
Okay, thank you, sir.